everyone, I'm Emma, midwife here at Beautiful Beginning Birth Center. Today we're going to talk about nausea and vomiting during pregnancy. Nausea and vomiting are one of the most common complaints in early pregnancy. There are a lot of things that you can do to help alleviate this problem naturally. The first thing, the most important thing that you want to do is address your diet. You should be eating 3 small meals per day and then 3 little snacks per day. When you get up at night to pee, and if you're not getting up at night to pee, it means you're not drinking enough water. When you get up, have yourself a little bit of a snack, even if it's a couple of nuts or a bite of a granola bar or a bite of yogurt or applesauce, anything that kind of helps keep that blood sugar level at an even level. It's when you go for long periods of time without food that your blood sugar level plummets, and that's when you kind of get a lot of the nausea going on. And then once the nausea starts, you get the vomiting, and it's kind of this cascading spiral. By having those small little increments of meals, it's going to help your blood sugar level stay in a wave instead of that big roller coaster that's happening. The other important thing is to make sure that you're getting some sort of a protein in you every 4 hours. After 4 hours, the body kind of starts breaking itself down to get the amino acids it needs to be able to do the metabolic functions within itself. So you want to make sure that you're replenishing that at least every 4 hours. Now, if those don't work, you can also do things like peppermint. You can either get peppermint oil, kind of dab it on the back of your ears. You can drink peppermint tea. You can have ginger tea, crystallized ginger, sometimes ginger ale. Canada Dry is our best choice, our preference here, because it has actual ginger in it. You can also do some pressure points like pericardium 6 on the wrist. You can get the C-bands that could put pressure on that acupressure point. The other thing you could do is see an acupuncturist or a chiropractor for adjustment. Chiropractic adjustment will sometimes help alleviate a lot of that nausea. Some of your other natural remedies are going to include some B supplement. There's some controversy over whether you should supplement with a B complex or a straight B12. Once you start adding in a supplement of one B vitamin, they kind of compete for receptor sites for the other B vitamins. So I personally prefer the B complex. In extreme cases, check with your healthcare provider, but you may be able to do a B12 and a Unisom combo for short-term relief. If you find that you're having excessive nausea and vomiting during pregnancy, you also want to be aware of something called hyperemesis gravidum. This is a very serious condition and it can be life-threatening. Thanks to Kate Middleton, we now have a little bit more information on what this condition is, and people take it a little bit more seriously. But if you find that you're going long periods of time without being able to keep any food or any fluids down, you may need some emergency relief. So always contact your healthcare provider if you're not getting any relief from natural remedies. Hope you're feeling better and have a great pregnancy.